Your young patient, and we're going to do a few procedures for him. He says this is just fun for him, but this is serious work for us. We're going to improve his lower third and middle third. In a sense, we want to take off some ears of his face. We're not doing a facelift here. We're going to get rid of his double chin. We're going to get rid of the loose skin around the jowl. Look it down a little bit. So you can see all of this tissue. We're going to take care of this. We're going to take care of that, and also a little bit in the middle third. We're going to reduce this grooving, take off this little back fat, a bag of fat on the blepharoplasty lower eyelid. So the plan is to do work around the chin, increase the height, remove this fat, stretch the muscles and the bone, improve the jowl also on both the sides, do a minimal augmentation to tighten the muscles here. At the same time, remove the fat pads, both the sides of the blepharoplasty. A minimalistic one, little work on the alar base and the grooves on the nasolabial region, and to give him a little bit more protrusion or projection on the cheekbone. So a bit of mala prominence, a bit of work on the grooves, on the eyelids, eye bags. He's also desirous of me to take care of this, which I have not promised him a lot, but we're going to reduce that a little bit. But the main essence is to augment the middle third and the lower third, to make the grooves, to make the creases, to get rid of loose tissues and skin. Now, what we can technically do is probably going to take him down 10, 15 years back in terms of the tightness, in terms of the fullness, in terms of the fact that the grooves will be reduced, the depressions and the scars and the wrinkles will be reduced. So that's the plan. We're going to be first doing a nasal intubation, and then working on the lower third of the face, and then switched over to oral intubation while we take care of the middle third of the face. That's the plan. I think it's probably going to take us about 3.5 to 4 hours. Thank you.
Old guy, what you people are going to do with my photos, 58 years, sir.
But that's so interesting, sir, such that more people, all the youngsters come here, they get their surgery done. But as they say, there's no right age, right?
I like that. I love my age.
Hello everyone, we are here at Richardsons Hospital. So we are here with a follow-up, with an interesting follow-up. Interesting why? Because we have done procedures which we usually do between the age group of say 20 to 30, 35. But there are people who genuinely need these procedures in say post 50 group. He's one of them. I'll just elaborate as to how he came to us. This is his pre-operative picture. He complained of age-related changes in terms of lower jaw jowling. The laxity of the skin is very prominent. Also, deep nasolabial grooving. These are frown lines, but these are vertical frown lines, also called as the glabellar region. Glabellar region is our forehead and nose junction. So that the region he had severe wrinkling, some wrinkling that caused severe grooving, so-called glabellaritis. Also, he had an ear tag. Yes, it can be easily missed, but we did remove that. Yes, I like to focus that. He had this cartilaginous small skin tag. So even that has been addressed. So his main issues were all this, also some amount of dental treatment he was seeking, which we have planned later. A lower blepharoplasty would have helped, but then sometime later that Dr. Sunil has clearly spoken to him. So what Dr. Richardson planned for him was a genioplasty to get rid of the jowling. It was an advancement genioplasty for him. Secondly, he has done alar base reduction. The excision was done not only to make the alar width narrower, but also to give a more youthful appearance. So we see that with the nasolabial grooving has gone. Also, because of the laxity of the skin, there was almost like a mid-face jowling, so as to say. For that has been taken care since Dr. Richardson explained him and also told him about something called as malar implants. So on both the sides, right and left, malar implants have been placed. The implants are not letting the skin sag. So the skin redundancy have gone. Interestingly, we have also done glabellar, got rid of the glabellar which is because of the hyperactive procerus muscle, the vertical lines. Yes, we do see it's not been removed 100%. The easiest way out could be a non-surgical method, something like a botulinum toxin. So we still see some faint lines here, but definitely not as deep as the grooving we see in the pre-operative photo. So this has been done with the help of an alloderm, and it's almost scarless. I say scarless because Dr. Richardson has done it through an upper eyelid blepharoplasty incision, which has been taken from his right upper eyelid. So since the scar gets concealed in the eyelid folds, that is why it cannot be seen. And yes, the skin tag has been removed. If you look to your left, sir, towards your left. No, sir, your left, yes. So we see that the skin tag also has been removed, and we see the stitch lines over here. So overall, yes, a lot of procedures have been done. We've explained him how it is helping him to give an overall youthful look, so as to say. Sir, you can have.
Honestly speaking, the service is excellent. And one more point, I can say that I'm coming here for my dental surgery. Probably in the month of December I'm coming here because of the hospitality what I got from these young people. That's all I can say. Thank you.
So he's very sporting. Thank you for your words, sir. He's given a feedback for the hospital. That's very kind of you. And so yes, so at the consultation itself, Dr. Richardson explained as to how an improvement can be done with respect to the lower skin laxicity, to the mid-face laxicity, also to the glabellar lines that he had, the deep nasolabial grooves, and the skin tag was also removed. So different kind of procedure belonging to a different age group, and hopefully he is happy to go. Yeah.
Thank you.
Thank you.
I'm very happy. The kind of, affection or whatever you name it. I'm very happy here.
Thank you, sir. Thank you.
So